Hello and welcome. I'm so happy that you're here. Today, I'm just going to take you through what histamine intolerance is, just going to give you a broad overview. And then I'm going to talk you through what my course, Live Low Histamine Well, includes, so you can make an informed decision about whether this is the right course for you at this time. A little bit about me before we get started. So my name is Marie Glazer and I'm a nutritional therapist. I have a Master of Science in Nutritional Therapy from the University of Worcester, and I'm registered with both the UK and the Danish Nutritional Therapy Associations. I also have a background in psychology. I used to work for the National Health Service in England using cognitive behavioral therapy and mindfulness principles to help people with depression and anxiety. Now I combine the knowledge of both to offer a more holistic approach. What I'm going to cover with you today is I'll give you a brief overview of what histamine intolerance is, then I'll tell you a little bit about my own story and my own journey with histamine intolerance. Then we'll think about what does living well with histamine intolerance look like. And finally, we'll look at what's included in the course and how I might be able to help you. Histamine intolerance doesn't mean that you can't tolerate histamine. Histamine is actually essential for our bodies to work properly. So histamine has lots of beneficial effects, as well as those negative ones that those of us with histamine intolerance struggle with. What it means is that your body is not good at degrading histamine. So the levels build up to very high levels, and it's those high levels that then cause uncomfortable histamine symptoms. So even somebody without a histamine intolerance might experience these symptoms if they have a very high histamine load, which sometimes happens when people eat spilled fish, and that can cause symptoms of poisoning because at high levels, histamine is really uncomfortable. But generally, we do need histamine. So when we're thinking about histamine intolerance, we're thinking about what's causing your body not to be able to degrade histamine and how can we improve your body's ability to degrade histamine so that you can have the histamine your body needs without the symptoms. Lots of people might be surprised to realize that their condition might actually be associated with histamine. So symptoms of histamine intolerance can mimic lots of other health conditions. And it's a really long list. I'm just going to whiz through them, but it includes things like eczema and rashes. So if somebody tells me eczema, my ears always prick up and I always think, oh, what about histamine? Acid reflux and GERD. And this one is quite surprising for many because it doesn't seem to be associated. It seems like a really random connection, but actually very, very often when people struggle with chronic acid reflux or GERD, then it's a sign that they have some trouble with histamine. Irritable bowel syndrome, diarrhea, migraines and headaches, anxiety and mood disorders. Again, this is quite a surprising one, but histamine is very linked with our neurotransmitters, so it makes sense that those are linked. PMS and also painful periods. So the more painful your periods are, and also the more mood swings you have throughout your cycle, the more likely it is that there are some histamine connections, particularly if you also have an estrogen imbalance. Urticaria and hives, again, very common. Chronic pain, chronic fatigue, osteoporosis, again, seems surprising, but it's really linked. Fibromyalgia, insomnia, asthma and sinus congestion. This one is perhaps one of the more expected ones again. Unexplained allergic reactions. So when we have high levels of histamine, the body's response is pretty much what happens when you're having an allergic reaction. So in severe cases, you will actually go into anaphylactic shock. And so when you have these repeated allergic reactions and it's really unclear what the trigger is, you've had allergic testing done to see if there's anything they can identify and nothing's come out of it, very often it's histamine. Motion sickness and morning sickness, atherosclerosis, ulcers, schizophrenia, Parkinson's disease, arthritis. So the list is really long and this is not a comprehensive list. So plenty of conditions, plenty of symptoms fall into this category of histamine intolerance. And by getting to the root of that, we can really improve your symptoms. So my own story with histamine intolerance is a funny one. I've had digestive problems throughout my life. I grew up in Africa, so I was exposed to lots of parasites and infections and antibiotics. And there's also a history of celiac disease and autoimmune conditions in my family, so I didn't get a good start. And through my own health journey, I discovered nutritional therapy and I began to address the issues in my gut, and my digestion improved significantly. And all my symptoms seemed to go away. My bloating, my digestive problems, IBS-like symptoms, all of that went. And then the last 2, 3 years, I started to experience regular joint pain. So every morning I would wake up really sore joints, stepping down onto the floor would hurt my feet. So quite severe joint pain, and gastric reflux. So every morning I would wake up with a sore throat. Throughout the day, that wouldn't really go away. And it was a sore throat down here at the base, which is an indication that it's acid reflux. Sour taste in my mouth, all these kinds of things. Very painful periods all of a sudden as well, which I'd never had before. And I didn't even consider histamine intolerance because I kind of thought if I address the issues in my gut, there shouldn't be anything going on. But then I worked with my own nutritional therapist because, we should never treat ourselves. And that nutritional therapist ran a DNA test on me. And my DNA test showed that I have a genetic mutation, which means that my body is quite bad at producing the substance that the body uses to break down histamine. So some of you might already know that it's called DAO. Which means my histamine capacity is much lower than it is in other people. Even if my gut is functioning fine, that's still not going to be as much as it would be for other people. So for me, cutting out histamine, finding those trigger foods, trigger lifestyle things is really key to reducing my symptoms. And that's what I've done over the past year and a bit. And I've really noticed an improvement in my symptoms. So particularly my periods are much less painful. I have hardly any joint pain. I can step down onto my feet in the mornings. My sore throat has become much less frequent. So it used to be daily. Now it's every couple of days, and it used to be all day. Now it's just for a little while after I've eaten something that I shouldn't have. So, for me, it's really made a big difference. And whilst I've been kind of trying to figure out, how can I best eat low histamine, there's lots of foods that I really miss. It gets really complicated cooking for two. I've come across a lot of different strategies, and those are what I want to share in my course. But I've also kind of noticed that many people who have a histamine intolerance just end up cutting out loads of foods and end up with a very limited diet. And as a nutritional therapist, one of my key things is that I want everybody to have as diverse a diet as possible. So food isn't a stressor for them, but a joy, and that their body can be nourished by everything that they're eating. And when we have a very limited diet, then that's very tricky. And with histamine intolerance, as long as it's not just genes that's causing your intolerance, there's actually a lot of things you can do to improve your tolerance levels. And so those are the things that we work on in the course. So noticing, okay, what's causing your intolerance and how can we address those so we can improve your tolerance levels as much as is possible. That's going to be different for everyone. So my histamine intolerance is genetic. That means there is a point where there is nothing more that I can do. My genes are just not going to be producing any more DAO. But there are things that I can do to help my body break down histamine. So I don't have to have, a very limited diet. And I've also found out what are my main trigger foods. So I can have, certain foods that might be on a high histamine list without it causing symptoms because I know these foods are not triggers for me. And I know what's my tolerance level. So I know that maybe eating 2 pieces of an orange is okay, but eating a whole orange is going to cause a sore throat. So those are all the things that I hope to share in this course with you. And that's kind of also what's involved in how do you live low histamine well. So living well with a histamine intolerance does not mean having a super limited diet, only eating low histamine foods and never daring to try anything new. That's not what I want for you. I want you to have a really vibrant diet and life, and that's why we've kind of come up with this course. So to live low histamine well, you need to know which of the 7 root causes applies to you. So it might be 1 or more. Once you know what those root causes are for you, you can start to address them using diet and lifestyle. Then you also need to find out which are the foods and stressors that trigger your histamine response. So for me, one of the big triggers is oranges, for example, so citrus fruits. Even though I know that there is a small amount that I can tolerate, if I have any more, it really triggers a response for me. So by knowing which foods are my triggers, I can then choose to have a varied diet that just excludes or really reduces those trigger foods. And stressors, because it's not just foods that trigger histamine release. So in the course, we'll really go in depth into what else other than food causes your histamine levels to rise. Then we develop a personalized low histamine meal plan. So you figure out your triggers, and then you figure out, okay, which foods can I eat regularly and in which amounts so that I feel well. And as you address your root causes, you want to be reintroducing foods, because what you'll find is that maybe in the beginning, when your histamine tolerance is totally flared up, there's loads of foods that you can't eat, that then once you've addressed your root causes, you can eat again. So that reintroduction is really important to make sure your diet is diverse. And then you need to identify supplements, foods, and lifestyle principles that help you to reduce your histamine load. So again, it's really personal. For different people, different things will work. But for example, for me, stress management, being relaxed when I'm eating, moving, getting outdoors, all of that I know helps me to tolerate histamine much better. And I could really see that. We went on a camping trip over the summer, and just by being on the camping trip, moving, being outdoors, even though my food was totally not low histamine, I had hardly any symptoms. So, there's really some things outside of limiting your diet that you can do to live low histamine well. So what does the online course include? It's a 4-week online course, and you will have access to a secure client portal on my nutritional therapy practice manager, which is called Practice Better. So all your data will be stored there securely, and you and I can communicate through that portal as well. You'll receive weekly videos like this one on low histamine living. So we'll cover what is histamine in more depth, what is histamine intolerance in more depth, what triggers histamine, what stops you from being able to degrade histamine, and then we'll look into some solutions. So we'll look into how do you develop a low histamine diet, how do you address root causes, which tests might be suitable for you, which supplements might be suitable for you, and each week that's broken down into videos so that it makes it really easy for you. We also have weekly Q&A sessions with me. So those are group online sessions via Zoom, and you can register for those every week and just log in, come join the conversation, ask any questions you might have, get some support, get emotional support from the rest of the group as well. And we'll do our best to answer all of your questions. You'll also get 3 7-day meal plans, which include recipes. So some of those recipes you can find on my website, but some recipes are really just for this course because they're specifically developed by me for people with histamine intolerance. You'll also get a comprehensive low histamine shopping list that you can download as a PDF, have on your phone, or take with you as a piece of paper whenever you go shopping and you're standing in the supermarket thinking, what can I eat? So that's really helpful to have, and just kind of get into your mind, okay, these are my go-to low histamine foods. And don't worry, it's not a short list, it's a long list. So there'll be lots of foods that you can eat. You'll also get practical PDF handouts every week to make low histamine life easier. So kind of a food storage guide, a shopping guide, cooking guide, things like that, just so you can really start to think about practically, how do you make low histamine living work? There'll also be questionnaires. So we'll be assessing your histamine load. The questionnaire on root causes and your symptoms will be in there. So some of these you will have completed before if you follow the links in your histamine intolerance score sheet, but some are questionnaires that I just reserved for people on the course. And of course, if you do the root causes questionnaire within the course, then we'll do much more work analyzing it. So you'll have a much better understanding of what your results mean. I also recommend functional medicine tests and supplements. These are not included in the course. You don't have to do them, but they can be really helpful. So depending on your questionnaire scores, there'll be different recommendations. So it won't be the same for everyone. And then through me, you also access reduced price to those. So if you then want to order them or buy them, then you just get in touch with me and I'll send you the links and you'll get those discounts. So for the supplements, you'll get a 25% discount. And then the functional medicine test, that really varies based on the provider. In terms of functional medicine tests, what you'll find is that the results are quite confusing. So it can be worth booking a session with me and I'll look at your results before that session and prepare for a few hours to then give you a really comprehensive test interpretation, including my recommendations. So you'll get a reduced price on those sessions as well if you're booking them through the course. And finally, we have a secure non-social media group chat function for community support. So through your secure client portal, you'll have access to this group chat function where we can share, you can get support, you can ask questions and get replies from other community members, meet others struggling with similar things. So I think that can be really, really helpful. So the course costs $49.99. It's a really competitive price, you might notice if you've been shopping around a little bit. And the reason for that is that I've really designed this course to make it accessible to everyone, to as many people as possible. I find it very frustrating that complementary healthcare is not affordable for so many, and particularly people who possibly need it the most. And so I really try to keep my prices as low as possible. So that's the price. And if you book your course within 14 days of receiving your histamine intolerance score, you get 10% off as well. So if you've done that questionnaire, go ahead and book as quickly as possible. Or if you haven't done the questionnaire yet, then go do the questionnaire and then book your course, because it really is worthwhile. And if you're not interested in an online course, if you are not comfortable with group sessions, if you find it too difficult to follow along with the videos, anything like that, there are also a few one-to-one options that you can book through Afia's Kitchen. So first of all, I recommend to everyone before booking the course, just book a free 15-minute call with me so I can talk you through what the course involves, how it might help you. We can go through your specific example. I can get to know you a little bit before you book. But in that call, you might also decide, actually, no, I'd like to go ahead with a one-to-one package instead. So I have affordable one-to-one packages tailored to your needs. So there's a 2-session package, a 3-month package, and a 6-month package. And you can just have a look at what seems most suitable for your current needs and situation, financial, practical, time-wise, anything like that. I mentioned before, you get a 25% discount on supplements ordered through me. So if you work with me one-to-one, you'll get that same discount. And you'll also get the discount on functional medicine tests. And thanks to my background in psychology, when you work with me one-to-one, you also get a lot of support from a kind of behavioral and psychological perspective. So I do use the cognitive behavioral therapy and mindfulness-based strategies in my sessions. And I know that many clients find that very helpful, especially as they're making changes that can cause a lot of stress perhaps, but also histamine intolerance is often actually linked with emotional factors, and addressing those can be really helpful in one-to-one sessions, and that's a bit more difficult on the course. So that's all the information I wanted to share with you today. What you need to do next is book your free call. So whether or not you feel like you want to go ahead or not, just book the free call because it's free. Make the most of it. Get to know me a little bit, get to know a bit more about the options, and then make your decision afterwards. If you've done your histamine intolerance score, book your online course within 14 days to make use of that discount. And follow the link on your results sheet to find out your most likely root causes. So that will link you straight to the questionnaire that takes you to the root, that gives you a bit of an understanding of your root causes. And I'd also recommend that you have a look at afiaskitchen.com to look at my low histamine recipes, so you can start to cook low histamine even if you're not doing the course and not working with me one-to-one. Because I can promise you it makes a big difference when you cut histamine down in your diet for 2 weeks, you'll start to notice a reduction in your symptoms. But that's not the only thing you need to do if you have an histamine intolerance, which is why you should book my course and find out your root causes and address those as well. I really hope that I get to meet you soon, but in the meantime, get in touch. I'm always happy to answer your questions. So you can reach me at Afias_kitchen on Instagram, Inside Afia's Kitchen on Facebook, or Marie at afiaskitchen.com. I wish you joy and health, and I hope to meet you soon.